So what I would like to explain is how the groin hernia happens. We are born with a little defect in the muscle. The muscles are here. Let me draw them so you will get an idea. So the muscles of the abdominal wall are 3 layers. Let's focus on the superficial and the middle layer, and they look like that in the abdomen. Okay? In these muscles, there is a natural hole here, all right? This natural hole is sealed by some fibrous tissue, membrane. But this hole is extremely important because it allows some vessels to come down from the abdomen to the bottom of the scrotum in men, and allows a duct to go from the testicle up to the bladder to evacuate natural fluids. So these holes are extremely important to be present, but they always stay sealed, only allows these 2 structures to come out. Okay? But what is hernia? Hernia is when not only these structures, the intestine is here. The intestine will come out from these holes like that. Before the intestine comes, there is always a layer of fat in front of the intestine. Okay? Sometimes it's only this fat comes out. All right? The hernia starts small and the fat only is present, and that's usually painful. When the hernia defect becomes bigger and the bowel comes out with it, it's less painful, but a lot more dangerous. Because if the bowel gets stuck, it can die. And that is an emergency that can make people really sick. So the rule is we do not leave hernias. We fix them, except if the patient is really not fit to have an operation. How do we fix the hernias? The traditional method that happens for many, many, many years means that we make a cut here, but this cut will mean that we'll go through these muscles, we'll cut them. Not only they have original hole in them, but we'll make further cuts. Obviously they heal, but in up to 20%, this healing is weak, so the hernia may come back. Especially if we are not careful, if we have constipation, if there's problem with waterworks, urine, or we carry weight, or we do exercise early enough. And after these operations, people have to really be careful with what you do for many months. And it's also a little bit sore and it needs staying in bed for a while. For the last probably 20 years or more, probably 30 years, we started to do this by what we call keyhole surgery. Keyhole surgery is simpler because what we do, if this is the abdomen, like that, and this is the belly button, we make a small cut, a tiny cut here, and there are 2 ways, either tiny dots here, 5 millimeter each, or 1 dot here and 1 dot here, 5 millimeter each. And through these, we introduce a camera here, and a clever instrument here, and a clever instrument here, and we fix these hernias and put a mesh so it doesn't come back. Because we do not cut muscles here, the pain is negligible, really pain-free. And fixing the hernia from the inside, it will make it withstand the pressure a lot more. So it's unlikely to come back. So if we say there is 20% chance of the hernia coming back with the open method, this is about 4%.